Hello, everyone. I'm Dr. Renee. Today's podcast is going to be on sciatica pain and how it can be relieved because often it's unbearable and overpowering. Joining me is Dr. Kavita Gupta. She's a doctor of osteopathic medicine, specializes in physical medicine and rehabilitation, and is affiliated with many hospitals in southern New Jersey and Philadelphia. Let's talk about sciatica pain, which radiates from the lower back and goes onto your lower leg, even up to your calf and foot, and it follows the sciatica nerve pathways.
Mm-hmm.
So how do we distinguish between sciatica pain and lower back pain?
Okay, so low back pain is obviously one of the primary concerns why someone's going to see their doctor, because it can be something that can be limiting from their normal activities. So low back pain, when it's just predominantly across the back and it's not radiating, when we're talking about radiating or sometimes called sciatica, that is when, you have two types of pain problems. Back pain, when it's just across the back and it's just limited to not going anywhere into the legs, associated with any type of numbness or any type of electrical or burning or a type of shooting type sensation, which is oftentimes related to sciatica. That's how we differentiate the two. So when you're talking about back pain to your doctor, you want to mention as much detail. When you're mentioning, oftentimes we throw sciatica. Oh, I have sciatica. Sciatica can mean a lot of different things because they say it's shooting. How far does it shoot? Does it go into the foot? Does it shoot all the time? What makes it shoot? So these are questions that someone who's saying they have sciatica, or oftentimes it's in the medical world, it's called radiculopathy. We want to know details. We want to know details about the characteristics of that sciatica. Where in the leg? If we're talking specifically about the back, where in the leg does it go? Is it in the front of your foot, the bottom of your foot? Is it constant? Does it come and go? Is it only with certain activities? So sciatica is a very, you're opening Pandora's box when you say sciatica. You want to have all the answers because these are the questions that I'm going to ask, or anybody who's dealing with specialty in back pain is going to ask.
So it could be numbness or sharp pain. It could be weakness and numbness in the leg. So all these symptoms are part of sciatica pain?
Yes, the sciatica, think of it as sciatica equals shooting. So when you have a shooting, it's kind of radiating. So sciatica is oftentimes related in those ways. So, but when it's low back pain and you just feel it, they'll say, doctor, it's kind of just across my back and it doesn't go anywhere. It might go into my buttocks, or it might go into the groin, and that's all it goes to. That's your typical classic back pain, your low back pain. But when it's that shooting and that radiating electrical, shooting all the way into the foot, that is your sciatica. And that is how we differentiate. And, the more in the detail is how, we're going to be able to help you better.
It's more like electric shock, something really strong and unbearable.
It's kind of like as if you're, as if when you fall, when you put pressure on your arm and your arm falls asleep or your leg falls asleep, sometimes people can feel that. Sometimes people can feel a burning sensation, pins and needles, like ants are crawling on the leg. And we're talking about there may be associated weakness in the leg. If we have weakness in the leg, that the doctor will need to know, because if you have weakness in your leg where your leg is giving out, or you're having trouble going up and down stairs, or you feel like your knee is going to buckle and you feel like you don't have the strength to lift your leg, and let's say going up and down stairs, that's important to know because the nerve could be so compressed that it may need further attention. And that is what you need to, and if it's going for a long period of time where you have the shooting, the burning, and now weakness, that turns into a situation you don't want to neglect. You want to address that. You want to, have that evaluated.
So that's the time when you seek medical help. Even before that.
Yeah, I mean, like you want like an acute low back, like let's say you went shoveling and you went in the winter and you shoveled for a couple hours and you have this back pain and now you can't move around and you're stiff. Those things can kind of resolve very quickly with some ibuprofen and some ice packs and just resting the back. But if it goes on like this for several days without relief with these type of simple mechanisms, and you're now developing these symptoms of numbness and weakness and trouble with your legs giving out, then and it's going on beyond like 5 weeks, 6 weeks, and it's progressive, and it's limiting your routine activities, you want to have medical attention. Or if you want to have, or if you haven't, if you've done physical therapy. I mean, these things, before we even progress into physical therapy, or if there's been trauma to the back, your doctors may want to get a basic x-ray before they start introducing like physical therapy and things. It really depends on how this back pain started. If it's something that just came out of nowhere and it just, someone may say, I was reaching for a book and all of a sudden I got the severe back pain. Well, the reaching for the book didn't cause the back pain. It was something there for a while, and it was like the straw that broke the camel's back that kind of created this cascade of problems. But if you say to me that I was working and I fell off my desk at work and landed on my back, well, that's a little traumatic, and that's more than just reaching for a book. And then that prompts me to think that maybe there's something traumatic happened, or you fell off a ladder. Then we may want to get immediate x-rays right away and see.
So can it be like a previous injury or a herniated disc that could be one of the root causes?
Absolutely. That is like the reason why someone may have, that's the number one reason why someone could have sciatica, where something is pushing on a nerve,
Yeah.
and a herniated disc is what's sitting very close to a nerve and can cause, sciatica or shooting symptoms.
So do you have a patient take MRI test?
Well, MRI tests, yes, are very expensive tests. And in this day of, getting tests right away is not that easy. So sometimes we have to do some basic tests, like a plain x-ray, or we might have to try some basic things to make sure, maybe the pain could get better in a couple weeks, 1 or 2 weeks, with just basic conservative things. If it's not improving after, let's say, 3, 4 weeks, an MRI is typically the next thing. So we would definitely order the MRI.
So let's talk about some self-care measures, exercises, physical therapy, hot compresses, cold packs.
Right. Those things are very important, especially when you're trying to treat an acute injury. So there's like acute pain and chronic pain. So acute is anything that happens within, and you have a situation within 3 months. You get hurt, you're in an accident, or you fall, and within that 3 months, we call it acute. How do we address acute pain? We use different simple treatments like ice, anti-inflammatories, your typical ibuprofen, your Motrins, those things that are typically indicated, rest, simple therapy exercises, basic stretching, or the typical acute phase treatments. When it goes beyond 3 months and nothing is helping, we're looking at this thing turning into a chronic problem. So it's very important to treat these situations very early within that 3 month period. So how do we kind of treat it? Like you were saying, physical therapy, using a therapist, people say, doctor, I've done physical therapy. I did it for 4 weeks. It didn't help. The idea of physical therapy is like you go to school and you're not doing so good, right? And you get a tutor. What does a tutor do? It teaches you skills, how to do things better. So a physical therapist is like your tutor for back pain. Your tutor is going to watch you do the performance of these exercises and make sure you're doing it safely and correctly. If you're not doing, people say, I walk every day. That is not addressing your back. That is addressing your heart. You're doing cardiovascular exercise. You're not doing anything specifically for your back. So a physical therapist is going to design specific exercises to address your back and to strengthen those muscles that is going to prevent you getting re-injured. So, and making sure the exercise you're doing correctly. Some small incorrect maneuvers in your exercise can cause more damage than good. So, and then the physical therapist and even the doctor, like I personally believe a lot of different modalities, like using cold compression. And I use a company, TheraPoint, and TheraPoint, they have a unit, is a cold compression unit, which is very good to use because people will say, I use ice for 15 minutes a day. Well, that's not enough. You have to give ice a very around the clock treatment in an acute injury because ice gets the inflammation down. It gets the muscles contracting very slowly. It helps that area recover, but you have to do it regularly. A cold compression unit gives that area compression in a very rhythmic pattern. So you're not going to be able to do this on your own every 15 minutes, putting an ice pack there. At rest, when you're sitting at home, when you're supposed to be resting with an acute injury, you put this unit on, it's going to give you that. That with rest, ibuprofen, or the anti-inflammatories, and the gentle exercises is going to rehab you out of this acute problem. So that is kind of how you do it. And then, watching for low back pain specifically, you want to watch how you lift. All of the injuries in back pain happen with improper lifting, and people don't recognize how to lift sometimes. They just, especially when they're young, airport, picking up luggage, moving, or shoveling, are three common injuries of where people hurt their back. So you really want to bend at your knees. You don't want to bend at your waist all to lift up something. You want to go down with your waist at your knees. Use your abdominal core muscles to kind of take all this brunt of the strength of lifting something. And, and as we get older, those muscles don't work as when we were 20, or 18. We want to kind of take our time because those muscles are not, they have a memory. They don't know how to quickly work all together. All the muscle fibers don't know how to work all together to get that strength to lift something very heavy. And that's how injury happens. And you could tear muscle fibers, and muscles take a long time to repair.
Also good posture.
100% posture. And that's part of the physical therapy tutoring aspect. We call it back school. So like you're going back to school, or some way of like understanding the mechanics of your back and how to prevent these injuries from occurring.
Stretching exercises, knee to chest, how good are they and how effective?
Knees to chest are effective. Like you want to be careful. It really depends on any past medical history issues. Like someone, like for instance, who might have a hernia in their stomach, I would not recommend doing sit-ups because you could potentiate, one, a higher blood pressure, two, making that hernia in your abdomen worse. So you might want to do planks where you're not really bending at your waist. You're doing core. Pilates is excellent for back pain. Yoga, gentle yoga, because yoga is very good for facilitating stretching. But some people think they have to do absolute extreme postures in yoga, to get the full benefit. Not true. You can do basic stretches to your full capability, and still obtain good outcomes. But Pilates is probably the best thing for back strengthening because it's strengthening the core.
And if all these conservative measures, they fail, then what's the next step?
And that's when, unfortunately, they end up seeing a pain specialist. And that's what I specifically do. And my area of expertise is in musculoskeletal medicine, back pain, any type of pain problem. So back pain being the number one problem, what most people come in with. And back pain can range depending on the age that you're in. If you're a young person, you have a back pain, very unlikely it's arthritic reasons. It's probably you did a muscle tear, or you probably did a herniate, you blew out a disc or herniation. But as you advance in age, when you get late 50s or early 60s, you might have developed arthritic changes in your spine. And now you have arthritis, and you might have some muscle issues. You might even have a herniated disc. So now you have a compounded problem that needs to be addressed one by one. I give a lot of analogies to my patients. I tell them, think of an onion, and you have different layers of an onion, and you have different layers of your pain. So we have the muscle layer, we have the nerve layer, we have your bone layer. So each area has to have a special type of attention given to address that specific type of pain.
So The most important thing is to have a proper lifestyle and regular good exercise. And at the same time, preventive measures that we talked about, gentle yoga or stretching or Pilates, or so something that is not invasive so that it doesn't become to be like chronic pain. Acute pain,
Yes.
I guess, would be easier to manage, but when it's chronic, then it's a little more challenging to address.
Right. 100%. I mean, the takeaway point is if you have a back pain injury and it's not resolving within, let's say, 3, 4 weeks with conservative, gentle measures, then you're going to want to kind of have that evaluated because the more you wait, the harder it becomes to treat. And someone like me, the whole idea is you don't, someone will go see a surgeon right away. Well, no one wants to have back surgery because the idea of a good surgeon is not to operate right away. They want to operate on emergent and absolutely necessary cases because there is a potential chance that the back surgery may not go in your favor. You may end up with worse pain, and we don't want that. So someone like me is going to kind of give you all these conservative options. There's exercise, there's medicines, there's different types of conservative alternative treatments, there's regenerative treatments, injection treatments. This is all considered alternative, like conservative. If all of this doesn't work, then we have this conversation about if there is possibility of seeing a surgeon. But very few and far between, we have to go down that road, go down that path because we can work with the patient and manage the problem conservative. Just like, for instance, diabetes, high blood pressure, we don't have a cure, but we manage it. Back pain, you might have a chronic arthritic problem or a chronic, once a herniated disc happens, you cannot repair it unless you go for surgery. You cannot reverse it. So we have to manage it. How do we manage it? That's what my role is, to help you come up with management techniques.
Well, thank you very much, Dr. Kavita Gupta, talking about how we can manage sciatica pain, because it's very many times overwhelming and unbearable and very debilitating. This prevention is the key, and address it as soon as you are able to see that something is wrong, you start working on it.
Absolutely. Thank you.
Dr. Renee Mera, stay healthy, stay positive.